Hi, everybody. Welcome to another episode of Get Into It with Gila. I'm Gila Glassberg, your host, registered dietitian, and certified intuitive eating counselor. And today I have on Sara Feigenbaum. Hi, Sara.
Hi,
How are you?
good. How are you?
I'm doing good. Thank God. Thank you so much for joining us. I think that you have an interesting perspective that I have never ever shared on the podcast. So tell us a little bit about yourself. Where do you live? What do you do?
A pelvic floor physical therapist. I live in Staten Island and I practice in Staten Island. Pelvic floor physical therapy basically works with anything that has to do with the pelvis, anything really woman related. It's also called women's health physical therapy. So I work with people postpartum, during pregnancy, anything that has to do with the pelvis, pain in the pelvis, incontinence, diastasis, which is like separation of the stomach muscles, back pain, hip pain, and a lot of other stuff.
Very interesting. So could I let me take you back a few steps. How did you get interested in PT and more specifically pelvic floor?
So I got into PT because I always wanted to do something medical, and I also loved science and biology. And like of all the therapies, PT was like the most science based. So that's how I chose PT.
Mhm.
We heard about pelvic floor therapy in PT school, and it was like none of our professors knew about it. Whenever we needed to learn about it, they would like get these guest speakers in,
Mhm.
and it sounded really cool. I started in a regular clinic after I graduated, but like I always had it in the back of my head that I wanted to go into it. And then my coworkers would like send me anyone who had pelvic floor stuff, and I just saw like how much there was a need for it and how much like I was like telling one of the patients, I was like, I didn't have the capacity to treat her fully for pelvic floor in that clinic. But I told her there are people you could go to and people that could help this. And she was like crying and like, I never thought I would be able to have kids. And
Wow.
like, just amazing, like what you could do for them.
Wow. Do you think I'm just thinking this off the top of my head? It's so interesting because I've heard other PTs who do pelvic floor or other professionals in general to talk about the pelvic floor, maybe like at the gym or the like I know I went to a yoga class. The instructor like worked specifically on the pelvic floor. And but I also know that like it's one of those things that's like really misunderstood. Like people don't really know about it. Like so like I guess I'm seeing an overlap with intuitive eating, because people are like dietitians or doctors and they're just like, what? That's not true, So like this just like misinformation. Like, why do you think that is?
I think a lot of it, honestly, is because that area of the body is just so private and mysterious, and people think it's like so different than the rest of the body. Like you have back pain and it's like, okay, I have back pain. You have pelvic pain and it's like something's wrong with you. Like they don't know what's going on. They can't talk to anyone about it. It's just something you have to live with. Like there's just, it's not really like misinformation. There's kind of like no information. So people just make up whatever it is that they just think.
So in the field of PT, are you saying it's like now it's more research, it's more like evidence-based, people are learning more, they're more studying it?
Yeah, yeah, it's definitely becoming more and more widespread with doctors. Like slowly, doctors are starting to refer to pelvic floor physical therapists. It's still not enough as it should be, and we're trying to, as like a community of pelvic floor therapists, trying to really educate people, but also doctors about what we can do because the doctors don't always. There's not there are certain things that there's just nothing for the doctors to do. Like there are no medical interventions that the doctor could do. And they'll be like, do Kegels
Hmm.
or like use a dilator. Like they don't really like, so we're trying to show them that we could really like, I network a lot with doctors, tell them about what I could do. And we're trying to get the word out more, but it's definitely more than it was like years ago.
That's amazing. Could you, I don't know if you want to go so much into detail, but could you explain like what you, I know you said people who have pelvic pain, incontinence, back pain. Could you, I guess those are like the more general problems. I'm sure there's more specific problems, but could you explain like a little bit what you do, like on a day-to-day basis?
Whatever you're comfortable with.
Go for it.
Okay. So for pain, pelvic pain, or pain with intercourse, pain with putting in a tampon, like anything, pain with a gyno exam, anything like inserting. So there's release that I'll do manually. So like the same way you get a massage on your shoulder, like if you go to PT. So it's the same thing. Like the vagina is made out of muscle, and like you massage it out, trigger
Mhm.
point release, and stuff like that. We use dilators, which are basically things that like these like tubes that you insert, and then there's different sizes. So you start with a smaller size, and then you get bigger and bigger and bigger. Then we do like stretches and stuff. There's also certain positions like yoga positions, deep breathing, and things that relax the pelvic floor. Then there's the strengthening of the pelvic floor, which is used more for like incontinence, where you do Kegels basically, but you have to learn how to do a Kegel with like the rest of the core, and then holding the Kegel while you're doing something else, knowing how to do the Kegel right, because I think it's like 30% of women do Kegels wrong. So learning how to do a Kegel and doing a Kegel together with everything you need to do it with, and exercises, and that's in short what we do.
So you said that like your professors didn't really know about that. How did you just like learn on your own? Did you take special trainings? How did you learn?
A ton of courses and supervision.
Amazing. So as I was asking you before we started recording, I wanted to hear about the overlap between what you do and what I do, which is intuitive eating, but like more specifically body image and people who struggle with their food. So could you share that overlap?
Sure. So there's a ton of overlap between pelvic floor physical therapy and food in general, and also like intuitive eating and body image specifically. So the the whole like abdominal area and the whole GI system and food is very, very closely related to the pelvic floor because it's right on top of the pelvic floor. So it's basically like the pressure system that's involved. So anytime that you have bloating or pressure in the stomach, it pushes down on the pelvic floor. So like we talk a lot about um, diet and stuff that's gonna affect your GI system. So that's more like scientifically how it relates.
Can you share a
But
little bit?
like basically we do a bowel and bladder diary,
Hmm.
and they'll write like with each time they eat a food, like what are their symptoms? Like do they get more bloated? Do they urinate more? Do they pee more? Because like a lot of things are bladder irritants, so it affects that. Coffee is one that a lot of patients have to go off of, and they're very sad.
Hmm.
Um, and they'll find like their foods that are bad for them.
Is
And
it, do you
how
see a pattern? You said coffee, but do you see a pattern or is everyone just different?
there are certain like key foods that you watch out for. The bladder irritants are usually anything carbonated, seltzer, soda, caffeine, acid, are usually the bladder irritants.
I never knew
Seltzer,
that. Isn't that so interesting? I hope that this is helping so many people because I never heard that.
it's huge. I literally have patients like they're going to the bathroom like every half hour. They stop seltzer and it's like every 2 hours, like straight up. It's like
I'm
amazing.
curious how that works scientifically. Do you know the connection?
I never fully looked into it. We've like debated. My husband actually was like, it doesn't make any sense. By the time it gets to your kidneys, there's no way
Right,
there's any bubbles left.
right. It's so
But
interesting.
so we were like thinking maybe the pressure of the bubbles pushes down. I'm not sure really exactly how it works, but yeah, it's really, really cool. Like I see it like so often. Coffee also, like straight up could help you so much.
Wow, that's so interesting.
And drinking water, of course, like is the best thing ever.
Right.
Helps a ton.
Hmm.
Actually, I have like a lot of patients like they don't want to drink because they're scared then they're gonna have to go,
Hmm.
but they start drinking more and they actually have to go less because the urine less acidic, and then your body is like more willing to keep it.
Interesting.
So that's really cool. Yeah, a lot of cool stuff. So that's like the drinks, and then the food. It's usually dairy, gluten, all like the hot ones that people like to go off of. But I try not to have people as much as possible like fully eliminate any food group. So I'll have them totally take it out for like 2 weeks to see if it makes a difference. And then I'll tell them like start adding it in a little bit and see like what you could handle. It's like a lot of times it's just a matter of like dosing. So like don't have like cereal and milk for breakfast and pizza for lunch and lasagna for dinner. So
Mhm.
like have one thing of dairy a day. Cause like I don't like promoting the take things out. Um
Yeah.
yeah.
So you're saying dairy and gluten tend to be bladder
Dairy and
irritated?
gluten. No, so that is for the bloating.
Oh, okay. Got it.
The bloating really like the main thing that we do, it's all about the pressure system. Literally, like everything we do comes down to the pressure system. You just don't want things pushing down on the pelvis.
Hmm.
So like when you do Kegels, it's pulling the pelvis up.
Hmm.
When you're releasing things, it's like making it not pull down. When you have a prolapse, let's say, it's pulling down. Like you want everything up, 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 not down. So anytime there's like bloating, it's just pushing down, which we don't like.
So I think that's really interesting from an intuitive eating perspective because as you said, like we don't like to eliminate foods, but I do that with my clients as well, like as if it's not triggering, like to keep a food diary for a few days or even weeks. I do it more like to assess their hunger and fullness and their satiety, like like what you ate, like write down what you ate and how hungry you were and how full you became and how long that kept you, how satisfying it was, just so that they know. I say it's like data, like you'll know that if you have a salad, it's going to keep you for 1 hour versus a sandwich, which will keep you for two, like just that general knowledge of your body. But the interesting thing here is about like, let's say gluten and dairy, which are like such hot topics, even coffee, to know that like, I know like it sounds so cliche and maybe even a little against intuitive eating, but like moderation and variety, like it's not that you can't have any gluten or you can't have any dairy or you can't have any vegetables or coffee. I mean, I don't know about coffee because I don't know, but so like if you ate broccoli all day, you would have bloating. If you ate dairy all day, you might have bloating. So like just to like stop demonizing the food. Like I hear so many people say, "Oh my God, gluten and dairy, they're the worst thing ever for the human body." And I'm like, "What are you saying? Like, why are you saying that?" I guess I get why people say that because you're seeing it in your practice that people really do have negative effects from those foods, but it is based on like how much they're having it and maybe even when they're having it.
Yeah, totally. Two things that are just coming to mind while you're talking. First of all, the way that I got into that is because I go to a nutritionist, Dina Cohn, who has this hashkafa mindset about this. And she, like, I was like, I can't eat dairy, I can't eat dairy. And she's like, it's really about the dosing. She's the one who taught me about this. So like I saw for myself, it really like it's really true. Cause like you think like, oh, I take it out, so then it must be that I shouldn't eat it.
Hmm.
But like I love dairy. So like I was eating a ton of dairy. So of course, if I take it all out, I'll feel better. It doesn't mean that I can't have
Right.
any dairy.
Right.
Um, and also another thing that I'm very into that I tell all my patients, I'm very into being empowered and like having knowledge about your body, knowing about your body, and then making your own decisions based on that. So, which means I want you to eliminate it and I want you to know what your triggers are. And then you could make your own decisions. Like, I don't know, for me, I love ice cream. And like, I know sometimes if I have ice cream, like, I'll be like a little uncomfortable after, but like, to me, it's worth it. It's like
Right.
2 out of 10 discomfort. And like, I love
Right.
it. So, whatever. I like knowing it because I don't want to just get like bloated and not know what's going on and feel gross and like, I don't know why my body's whatever. But once you have it, like, it's your body and you decide what you want to do.
Yeah. So first of all, shout out to Dina Cohen. She's amazing. She's in Lakewood. And I actually just met Dina Cohen for the first time in person because we had a dietitian event in Lakewood. It was really cool.
Uh,
Yeah. And I mean, I know her just from, we're both dietitians, but the other thing I wanted to say, which I find really interesting and an overlap for sure in the nutrition field, is that like I'm actually teaching nutrition this year to high schoolers. And I'm like so excited that about this specific thing because I remember one of my professors teaching us this and I thought it was amazing. She was my professor, Professor Kant in Queens College, was very into you as the dietitian don't tell your clients what to do. You inform them and they make an informed decision. So like she taught us how to do research and how to read research and the strength of research and um, not like you like this is good for you, eat it. Like exactly what you just said. Like this might make you feel bloated, but if you have this amount, it might make you feel somewhat uncomfortable, but it will be worth it because it's so delicious and it's so much fun to eat ice cream with your family. But if you eat ice cream 5 times a day, yeah, you're probably not going to function well. So like as I think that is such a difference between diet culture and intuitive eating, like the philosophy, because like diet culture is like cut it out, you don't need it, shameful, why should you have to eat ice cream? Like what's the saying, like being skinny never eating ice cream never felt as good as being skinny, whatever the saying is. But it's really true. Like there's like so much nuance and there's so much individuality and there's so much like room for testing and trial and error. Like okay, maybe you can't eat gluten every day, but maybe there is a certain amount, or maybe not like multiple times a day, but like just that empowerment of like learn about your body and instead of just like, no, I can't eat any of those things, they're bad for me.
Yeah, it's really true.
So tell me more about the body image piece. I'm really interested to hear how people who are struggling, let's say with pelvic floor issues also are struggling with body image issues.
So there's a few different ways. I guess the main way is kind of like it's people who are not comfortable in their bodies. Like you start feeling like this part of my body has issues, is messed up. This part of my body is also messed up. Like a lot of people will come to me like, I'm a mess. I'm just a mess. Like this is a problem, that's a problem. Like they just like I feel like they're just not proud, not like they don't feel good like about a lot of different things. I think it just like all goes together, especially when it's like postpartum, let's say, or even 2 years after you have a baby. They just don't feel like they did before they had a baby, and they just like everything is just they want to feel like they did before they had 5 kids.
Mm,
It's not always possible, but and that's good. That's like like our bodies change, and it's
mm,
part of um growing, and it's like I heard of someone once told me that her friend's mother had like a big diastasis where like the stomach muscle opens, and she looked pregnant a lot of the time even when she wasn't. She had 10 kids, and she's like, I'm so proud. This is my trophy that I had 10 kids, and I'm so proud of it.
wow.
And like that's great. So I think that that's a lot of it, that they're just not comfortable with where they are, and then it like comes out because they're talking to me about these things that they're not comfortable with, and then it will come up, or they'll tell me like, oh, I gained a lot of weight, that's why XYZ happened to me. Oh, I know that if I lose weight, like it will help me and I'll get better.
Mm,
um so that's a lot of it. Once we start, like I try to be very careful when I bring up the food, not to like cause any misconception, or like have anyone think that I'm saying that they should lose weight or they're not eating well or whatever it is. I do bring it up though because it's important in treatment. But like a lot of times when I first start bringing it up, people will be like, "Yeah, I know I eat horrible. Yeah, I know I don't eat
mm,
healthy. I don't eat healthy," or they'll be like very defensive, like, "I eat healthy. I'm fine. I eat
right,
healthy."
right.
Um, so they're into that. Another thing is that I treat this diastasis that I was talking about, where the stomach muscles separate. It usually happens after pregnancy, but it sometimes even without a pregnancy will happen. Um, and people come to me mainly because they want their stomach to look smaller. Like that's why they're getting the diastasis treated. And that's really tricky. Like I kind of like I'm like conflicted with myself. Like sometimes I feel bad that I treat it because I feel like it's really promoting that mindset that like I need to look skinny. But like I think it's normal that people want to look good, and they don't want to have to look pregnant when they're not pregnant.
Mm,
And I really try hard to not be like make it about the inches that they lost, and trying to help them feel comfortable in their body and good, even though they're trying to get better. Like, just because someone's putting on makeup doesn't mean that they think they're ugly. So
Right.
like, it's kind of trying to have that balance.
So I know, I don't even know how to say the word say the word
Yeah, diastasis.
diastasis. So that's like, the muscles like separating.
Yeah,
Is
exactly.
it dangerous?
No,
Is
it
it
can
painful?
cause like back pain and stuff like that. Yeah, like it can cause like some pelvic issues. It's not dangerous in and of itself at all.
Mm-hmm.
Um, but yeah, there are surgeries you could do for it, tummy tucks and stuff like that. They'll pull it back together, but
Is it painful?
no, totally not.
So it's not like it's not like one of those things that has to be treated and then it happens to make people feel better because their stomach's smaller. It's like people are just doing it cosmetically.
No, so there are reasons why you would do it. Like when I treat, let's say, pelvic pain or pelvic weakness, I will also teach them how to contract the muscles that are like that I would teach for treating diastasis. Like it is part of the core. And when there's a part of the core that's weak, it does, like it does affect other things. It could affect everything really because it's all part of the core.
Mhm.
There's a certain treatment, another one that I do really more specifically for the diastasis, which technically like anyone could really benefit from it, but like I wouldn't necessarily just give it to anyone.
Got it. And in terms of like the body image piece, like, do you see like, do you have a role in like sort of like, even though you're not like a therapist or a dietitian or anything, but do you see yourself in a role of like trying to explain to women that like bodies come in all shapes and sizes and like bodies are supposed to change and like it makes sense that you don't have the same body that you did 10 years ago before you had 5 kids or 10 kids or whatever. Does that come up?
Sure, for sure, for sure. I hope I'm saying the right things. I try my best. But yeah, definitely like um we're therapists
Right, of
as
course.
I mean, like I feel like any medical professional ends up, it's all like if you're a good medical professional and try to be like holistic in your treatment,
Mm,
everything's gonna end up coming up. We're therapists, the anxiety and depression comes up because it's all related, and the body image comes up, and the medical things come up too. It's like it's everything.
right. It's for sure everything overlaps with everything and we need more like person-centered care and holistic treatment in general. So I guess thank God you're doing what you're doing and there is I think a little bit of a shift. Do you see that your words make a difference? Like do they accept your words or are they pushing away your words like no, it doesn't matter, I have to be skinny? Or do you think that the health at every size intuitive eating movement is making a bit of a shift? Do you see a shift?
I do. I can't say it's huge, but I do see a shift, especially because I'm a like expert. So they'll take my word for it like a little bit more.
Mm,
Like they won't think like, oh my gosh, it's so horrible. Because there are doctors who will, you'll go to them and they'll be like, you have to lose 30 pounds, you have to lose 30
right.
pounds,
Right.
like so they think like it's just horrible that they lose weight, and they'll come to me like, yeah, I know I have to lose weight. I know I have
Right.
to lose
Right.
like at least there's like another medical professional who's telling them that it's not necessarily like the main thing that they have
Right.
to do.
Right. For sure. I'm really happy that you're doing that. Could you share as much as you're comfortable to share about your own story with like food and body image and where you're holding now?
Sure. So I grew up, I was always skinny, always skinny, like a toothpick, like really skinny. And it was, I guess, like kind of what defined it. Not that it defined me, but it was one of the things that defined me. Like it was always part of me that everyone was always telling me that I was so skinny. And I ate whatever I wanted, like I wasn't dieting. It was just my natural self. And I started going to a nutritionist, Dina Cohn, because like I wasn't eating, like I guess because I was so skinny. Unfortunately, the reason why people start going to nutritionists and like trying to eat healthy is because they want to lose weight. But so like I never really thought about what I ate. But I really wanted to start eating more balanced. I was like eating like all the time snacks and carbs and like never be like I didn't realize until I started going to her, but I was never like really full. Like I was always hungry and like always snacking. I had no concept of like meals and snacks. It was just like eating when I was hungry. Like
Were
I would
you
have
brought
a
up
huge
with meals
meal.
and snacks and you just like didn't care? Or like was your mom like the chill type that was like, yeah, just have cereal and milk?
I was brought up with meals and snacks, but not like extremely rigidly. Like we would have tuna a lot for supper, and but it was meals and snacks. I don't know, because I guess like I always liked carbs, so I guess like as soon as I was in my own house and I didn't have to eat breakfast, lunch, and supper, especially
Right,
since I didn't have kids and I was in PT school, so my
right.
husband would pack me like this huge bag of like food and food and food and food because I was there from like 9 in the morning till 6 o'clock at night.
Yeah.
And like where I was hungry, I would just like pull out what I was in the mood of.
Hmm.
Um, and then it just like stayed like that.
Yeah.
So I would be eating all the time. And then like once I started going to this nutritionist, like I started realizing like I'm always hungry. Like I'm never, she's like, what does it feel to be like full? I was like, oh, it feels gross. Like to me,
Right,
like full meant like overstuffed. And
right,
then it was like either hungry or overstuffed, basically.
right, right.
So it was really hard, but I started trying to be more balanced. It was very, 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 very hard because I just like wasn't used to the whole like vegetable starch
Right,
protein thing.
right.
Um, and I was like petrified that I was gonna gain weight. Like I guess like anyone would be,
Hmm.
most people would be, especially since it was like such a big thing, like
Yeah,
in my life that I was always skinny.
right.
Um, so that's when it started like coming out with like the body image,
Hmm.
that really nervous to gain weight. Um, and then I remember I was so upset. I was expecting and I was like really working on eating better and eating better. And I went to the doctor, my OB, and I sat down and she's like, she weighed me or whatever it was, and she's like, you really have to slow down with the eating. I was like, I was so upset. Oh my gosh. And I was like, I was working so hard to eat better and to like eat and not care. And like here she is, and she just like whatever. And like I was like, I wrote like a whole thing. I was really upset. And I was like, she didn't even like look at me. I was like, just like pick your head up and like look at me. Like I was so skinny. Like and apparently there's like another chart for people who are like underweight, another growth chart for pregnancy. Like you're supposed to gain more weight if you were underweight when you started.
Mm.
I guess she didn't know about it or didn't care or didn't look. So after that, I was like, I'm gonna make sure that with my patients, I like look at them and I make sure to like really see the whole person and not just, say straight out scientifically what they need. Since then, my eating and body image stuff has gone like up and down. Um, but I'm really trying and I'm doing pretty well now. And I definitely like come a long way. And like what I was saying with like always being hungry, like I know what it feels like to be full now. Like
Hmm.
I'm not hungry. Like I'm like, oh my gosh, like I didn't realize. I was like, hey, like it's just like random time of the day and like I feel good.
Yeah.
That was like it was like, whoa, I didn't know there was such a thing. Um and like I'm definitely like eating more balanced and eating well and like trying to like make it a part of like my life. And I'm really trying to teach my kids healthy outlook on eating, both
Hmm.
like body image and eating.
Wow. So that's such an interesting story. So you like this is actually pretty common, that like either being skinny or like even having an eating disorder or like being the healthy one, like that's a big part of people's identity, right? So like I think I've quoted this on the podcast before, but I don't know if you've read any of Glennon Doyle's work. But she speaks about how when she became bulimic, I think when she was 10, and part of what she explained is that like she was always like when people would see her, they would comment about her, like, you're so pretty, you're so skinny, or they would tell her mom, like, what a pretty little girl. So like her identity was like, I'm pretty and I'm skinny, and if I do anything to threaten that, it's going to threaten me as my identity, which is like so warped, but it makes sense. Like I know for myself, when I was struggling in high school, with my own body image and food issues, like it was very much a part of my identity that like I was the healthy one, quote unquote. I was the one that was like had a lot of willpower, right? And especially like whatever, like if we're struggling with self-esteem in another area, this like really gets highlighted, you know. um so I've heard that before, that people who are very, even people who are very very skinny, really struggle with eating because they're so afraid of losing that status, which is so sad. But it just speaks to where we are in society in terms of like the thin ideal and praising weight loss. But also another interesting thing just to note is that like you were very skinny and you were eating carbs all day, like that's what you said, and you still remain skinny. So it's just interesting. People think like it's all about what you eat and how you move, and it's really not true. Obviously, the way that we eat does affect our body in some ways, but it's a very small percentage. It's really mostly about our genetics and nature versus nurture. But it's interesting just to note that you've actually you changed your eating, um but like you added more food. It wasn't like you added more variety of food, you added fruits and vegetables, and that still made you afraid of weight gain. And did you ever struggle with body image issues before that happened, or you always felt good about your body?
Yeah, yeah. I guess because like I was skinny, so it was never bad.
Right, but like I said before, that's not always the case. It's like people who are skinny still feel bad about their
Right.
for whatever reason. It could be that they don't want to lose their status of being skinny, or they don't feel skinny enough because everybody's always talking about it. Um, so yeah, and also like I guess the other interesting thing is like to note that like we for many reasons, I don't know what your reason is, but for many reasons we tend to not know about our hunger and fullness because we're just so out of touch with our bodies, because we're just, for so many reasons, maybe we're disassociating from our body, or we've had trauma in our body, or we're just too busy, like we're just too mindless, like there's just too many other so many other things going on, and like our bodies are like really first and foremost, like we can't function without a body. But it just for some reason takes the back seat. So it's like intuitive eating is very much about listening to the cues of your body, whether it's hunger, fullness, or even like sleepiness and having to go to the bathroom, like just like feeling embarrassed, like knowing what your body's telling you, like you said before, knowing when you're hungry, knowing when you're full, and like you said before about your patients, like knowing what triggers um like pain in their body, like that's just empowering. It's not like an obsession, like let me think about my body all day, but it's like it's just empowering to know that like our bodies are so much more than the way that they look, and they give us all these cues throughout the day and throughout our life, and like listening to it just gives us better quality of life.
Right. Yeah, it sounds like intuitive eating really coincides very well with how I work.
Yeah, totally. Were you familiar with intuitive eating before you started on your food journey?
No.
Are you familiar with it now?
A little bit, like not majorly, but I'm saying I've heard of it and I know like the basics.
Did it resonate with you when you heard about it for the first time?
Um, I don't think so. Like I don't think I was at a point that I would be able to do it.
Mhm.
Like I don't think like I don't know. Yeah, I don't know. Like I feel like I needed someone to kind of like start me off,
Yeah,
like show me a little bit like what's like normal before I could like feel that.
totally. Okay, so I'm gonna wrap up unless there's something else you want to share. But before that, I wanted to know if like, because you are a pelvic floor PT, is there something you could share with the audience that would just help people in general, whether they are struggling with the few things that you said, like incontinence or back pain or diastasis, whatever the word is.
Yeah, you said
What
it
are
right.
what are some things they could do on like a daily basis just to help themselves?
Sure. A few easy ones are, I mean, with the diet, like what we were talking about, take out seltzer, take out coffee, drink a lot of water. That helps with so many things. Drinking water. Um, Deep breathing is huge. I'm not going to say anything that I wouldn't want someone to do without a physical therapist, like watching them do it.
Okay.
Things you could do on your own. Deep breathing helps a lot. Like people think it's just, I mean, like it does help with stress, and that's
Right.
great. But like with so many things, I see like a total correlation with stress. But it really physically also, the diaphragm is part of the course. So it's the first thing that I teach before I go to the pelvic floor and then to the stomach. So deep breathing, you could watch a YouTube video or whatever it is, but really like learning to expand the ribs this way and breathe in with your nose, breathe out with your mouth. That's huge. What else? There's a lot of yoga positions that you could look up, like the butterfly pose. The butterfly pose is great. Go into the butterfly pose and relax your pelvic floor. Like try to get in tune with your pelvic floor and feel it relax. Hold that position for like a minute or two every night. That's a really good one. What else? Um, Doing some pelvic tilts, again, like look it up on YouTube, but like moving your pelvis back and forth, that could really help with a lot of things. There are some like external things that you could look for, like if you have prolapse, there are like these shorts that you could wear. Prolapse is like when one of the organs is like pushing down and peeking through the pelvic floor. There are shorts you could wear. There's a lot of things that you could look at that could like help you in that way. Trying to think incontinence. Um, Kegels, but like it's scary
Right.
to say
Right.
because there's a lot also like there are things sometimes if there are certain issues you have to take care of before you could do the Kegels, then like the Kegels could. That's my trick. Don't do Kegels unless a certified physical therapist tells you to do Kegels. Because really doctors or either people just think on their own do Kegels or a doctor will tell you to do Kegels and like it could really mess people. I just had a patient like an hour ago who went to PT and they told her to do Kegels and it really made her worse.
Right.
So don't do Kegels unless you know that you really should be doing Kegels.
Okay. All really important things. I think that you're doing such important work. And do you have like a vision where you want to take your business? Like, do you see yourself going into like schools, like high schools or seminaries or um like OBGYN offices? Like, do you see yourself expanding? Because like it's such important information that you have that people really don't know.
Yeah. So I actually teach 12th grade biology and I have a section on female reproduction where I teach a lot of this stuff. And I think it's so important to, like I said, empowerment, like know your body, like know what's there. It shouldn't be so mysterious, like you should know the holes and what they do and what they're for and use a mirror and look at, what it looks like. So
Do you
I
think
do.
that's like do you think that's like a sneeze thing that we have like a misconception that like not knowing that is not sneeze? Do you think that's what it is?
So I was just talking to someone about this. There definitely is that piece, for sure, no question, that it kind of like gets mixed up, like what's SNEIS versus like private versus like just because it has to be private, it doesn't mean that it should be private to you.
Right. Right.
But like everyone always blames it, like, oh, from people. I treat so many non-Jews who also have no clue what's down there and who
Right.
also are embarrassed of issues that they're having with marital relations and everyone thinks like it's just like a from thing and like it's really not. I do
Yeah.
it could be it's more and like I do see it, but it's definitely not exclusively a from thing.
I was actually just thinking about this today, before we started talking today, that like there's such a difference between like privacy and shame. You know what I mean? Like there's things in our lives that are private, but we're not embarrassed about it. It's just not for public consumption. And then there are things that we lump together with privacy and shame. You know what I mean? And like, so like, I guess explaining the difference, like I think that I happen to try to be very sensitive on my podcast about things that um things that I share publicly, and things that I share privately, not because I'm embarrassed, just because I feel like there's different forums. I know that there's a college teacher out there who's amazing and incredible, and I took one of her courses, and I know that she got like a lot of pushback because she had like these public courses um, talking about these types of topics. I wouldn't even say it was so public. It was people who, subscribe to the class, but just like she got pushback that like these are things that you just talk to with your mother or your college teacher, and like she felt it was so important that there was a place where anybody who was struggling could find support. And like I guess it's a delicate balance, because like we are tznius, we are modest, but like I guess the definition of modesty is I don't want to say up for debate, but it's interesting. It's like an interesting fine line. Yeah.
Balance, and there's sometimes you also have to know, like sometimes you'll get pushback from, there's always going to be rabbanim who are going to say that something's bad.
Hmm.
Like you have to know where the pushback is coming from,
Right.
like
Right.
who do you go by? You have your own people. And I'm literally like, from when my kids are little, like obviously I'm not explaining certain things to them, but like I'll, name the parts of their body, and like I'm like, yeah, we don't talk about it like outside of the bathroom, but like you could always tell mommy,
Right.
if something hurts you or whatever. And I'll say like, oh, does that hurt you? And I'll name it. Like
Right.
was like, oh, we shouldn't say it. I'm like, no, it's a part of your body. Like, are you gonna say never say the word hand? Like
Right.
it's a part of your body, and they should know what it is, and they should be able to tell me if it hurts them or whatever it is. So
I
like
know
I
it's
try to
it's
already
really
start
true.
there.
Well, like the overlap with that in like intuitive eating, I say this a lot, is that like because we like turn off our kids like hunger fullness cues by saying you're not hungry, or you must be hungry, or you're not full, blah blah blah. It's like the same way that like if somebody we used to like shame our kids to be like, go hug your uncle even if you didn't want to, and now it's like if you don't feel like hugging your uncle, like please listen to your body and don't touch someone you don't feel safe to touch. Like, we're really trying to honor that. So it's the same thing. But I do, not to get too much off topic, but I do struggle with telling my kids certain names and words because I do find that they just like say it for fun.
I
So,
will tell them, right. I will say, no, it's not appropriate to say it out of the bathroom. You can only
right,
say it to a mommy, and it has to be in the bathroom. My main thing is that it should be to a mommy. So you
right,
don't just say it. Like you can't.
right,
I totally. I also like. I wasn't sure. I'm like, no, I shouldn't tell them not to say it. This is so not appropriate. So that's when I was
right,
like, say it to a mommy in the bathroom.
right. Kids have like this special antenna of like knowing what they could say like at the shopping center when you're like at your Rev's house, and I'm like, haha. Um,
Yeah.
but yeah, yeah, and I guess everybody there's nuance there too. Like every family has to be comfortable with what they decide, but
Right.
I guess
Exactly.
the ultimate goal is like just empower, like, and same thing with kids. Like I say about intuitive eating and help at every size. Like parents say, like, don't say the fat, don't say the F word, don't say fat, blah blah blah. I'm like, let them say it, let them ask you. Like fat doesn't have to be a bad thing, but if you don't let them talk about it and you just say, that's me and don't say that, then you're just really disempowering them and confusing them. Like, why is it bad? If you don't explain it to me, why is it good? Why is it bad? Why is it neutral? Like kids have to have that language and that safe space to talk to their.
Funny, like with my kids, I tried this intuitive eating with them also, and they're like, about one of my friends. They're like, "Mommy, right, well, like bracha or whatever." They're like, "Right, bracha's mommy makes them finish their food, but you don't make us finish our food."
Yeah, yeah.
Oh my God, they see.
Yeah, yeah, they do see. And even if we're like, it's discouraging because they're like still not eating or they're whatever they're doing, you feel like they're binging or they're hiding food, like just keep at it. I mean, maybe you'll need a dietitian to help you, but I'm saying um they do know. Like, and I know I'm getting way off topic, but I say like the same way that like if your mother never sat you down and told you like these are my value systems and these are the things that I care about so much in the entire world. If I would ask you as an adult, what are they, you would know, because whether they say it or they don't say it, we know how our parents feel and we absorb
Mhm.
it. So it's like really, really important that I mean, saying it, I think is important, but just, living by it and showing them and having a safe space is like so empowering for kids. Anyways, this is so great. I really learned a lot, and I think that women's health is so important, and just like having a space for it in all different areas is so important. So thank you for the work that you do and for coming on. And is there,
I mean,
right, sure, are you taking private clients? Do you want to share about your practice?
sure. It's called Orchid PT, Orchid Physical Therapy. I'm in Staten Island. You could look me up, orchidpt.com. And yeah, I'm taking private clients.
Okay, so I'll put that in the show notes so people could contact you. Okay, thank you so much for coming on. Have a great day.
You too.
Okay, bye.